The first time I see a new patient at consultation and I ask them, how can I help you? One of the commonest responses I get is for the patient to take their hands and say, I kind of want this result. And what they're really asking for is some form of lifting. And what I would say to a patient like that is there's really 4 ways we can do it. The gold standard would be a surgical facelift under a general anesthetic. We can also use devices like ultrasound and threads, such as suspension threads. But I think one of the most interesting uses of dermal filler is when we can use the filler to also give the appearance of a lifting to the lower face. Now, it's important to understand that a filler, the ultrasound or the thread cannot replace a traditional facelift. However, the amount of impact we can create is considerable. So the ideal patient would be someone who doesn't have excessive sagging, and we typically begin by putting the filler along the cheek. You'll notice that if I start raising the skin around my cheek, that the skin around my jawline improves at the same time. And this is the basic premise of a non-surgical facelift with filler. We simply inflating the tissues that have become deflated due to the aging process, and we're using that filler to actually get a lift in the mid-face, and in doing so, improve the lower face.